Hello. The following training presentation will introduce Penguin and provide information relating to the trial background and design. Penguin is the third randomised controlled trial from the NIHR Global Research Unit on global surgery. The Global Surgery Network has specifically prioritised surgical intervention trials aimed at reducing post-operative surgical site infections. Penguin has followed on from the Falcon and Cheetah trials. They are investigating different surgical interventions to reduce post-operative surgical site infections. Falcon is investigating the effects of two different skin preparations and two types of facial closures during surgery, while Cheetah is a cluster randomised trial investigating the effects of changing gloves and surgical instruments during surgery versus routine hospital practice. Penguin follows on from these trials and will investigate the effects of high and low oxygen concentrations on reducing post-operative surgical site infections. In addition, the trial will investigate the effects of using a mouthwash before the induction of anaesthesia to reduce post-operative pneumonia. Data from the surgical outcomes studies identified patients undergoing major abdominal surgery in hospital pneumonia rates affects 1 in 30 patients. The incidence is greater in high-risk populations such as those undergoing midline laparotomies, where mortality rates are more than 10%. In addition, the Globe Surge cohort study identified surgical site infection rates were more common in middle-income countries and low-income countries. Therefore, the primary objectives within Penguin are to assess whether preoperative chlorhexidine mouthwash reduces the rate of post-operative pneumonia at 30 days compared to no mouthwash, and to assess whether 80 to 100% of fraction-inspired oxygen used during surgery reduces the rate of post-operative surgical site infections at 30 days compared to 21 to 35% of fraction-inspired oxygen during surgery. Secondary outcome measures within the trial assess the effects of the intervention on death rates, readmission to hospital, reoperation, length of hospital stay, and return to normal activities 30 days after surgery. Penguin has been designed as an international, multicentre, pragmatic, outcome assessor blinded 2x2 factorial randomised controlled trial with an internal pilot designed to assess the effects of the trial interventions in low and middle income countries. For patients to be eligible for Penguin, they must be adults or children over 10 years of age in countries that allow children to participate in clinical trials, scheduled to have elective or emergency abdominal surgery via midline laparotomy with an anticipated abdominal incision greater or equal to 5 centimetres and given written and informed consent for the trial. Patients who are undergoing a caesarean section, documented or suspected allergy to chlorhexidine, unable to complete post-operative follow-up, have previously been enrolled in Penguin within 30 days, or have an American Society of Anesthesiologists grade of 5 who are expected to die with or without surgery and not eligible to participate in the trial. Patients who meet the eligibility criteria will be randomised at the level of the individual in a 1:1:1:1:1 ratio between the following conditions before surgery: either 0.2% chlorhexidine mouthwash and 80 to 100% oxygen, B, no mouthwash and 80 to 100% oxygen during surgery, C, 0.2% chlorhexidine mouthwash and 21 to 35% of oxygen during surgery, or D, no mouthwash and 21 to 35% oxygen during surgery. If there are any issues with providing the low oxygen concentrations, please contact the trial team. The aim of the trial is to recruit a sample size of 12,942 patients from 100 hospitals across 10 different low and middle income countries. Any centre in a low and middle income country providing abdominal surgical services with the facilities to deliver inspired oxygen concentrations of both 21 to 35% and 80 to 100% during surgery will be eligible to participate in Penguin. Thank you for listening to this presentation. The next training will discuss the patient pathway in Penguin. Goodbye.